Welcome to Roadmap to Residency Evidence-Based Applications. Hello everyone, I am Abhiraz. Welcome to our Club 250 Matchmaker sessions. We are currently in our psychiatry modules and we will be running through some questions with you guys to help you on your journey to 250. This video is all about phobia and social anxiety disorders. So here we have, during the interview, the patient makes little eye contact and gives brief answers to questions. Which of the following is the most likely diagnosis? A 16-year-old girl is brought to the office by her mother due to non-specific stomach aches and pains. She has no other medical history. The patient has missed more than 10 days of school due to the symptoms since the academic year started 6 months ago. The mother says that her daughter has always been anxious with a sensitive stomach, but the symptoms have worsened since the patient's best friend moved away a month ago. She has a few other friends but prefers to stay home and does not participate in after school activities. The mother says she worried for weeks about going to a party, and on the night of the party, she had an anxiety attack and started hyperventilating. She ended up not going to the party at all. The patient says she is just very shy and is afraid of being embarrassed or looking stupid in around others. Physical examination shows no abnormalities, and during the interview, the patient makes little eye contact and gives brief answers to questions. Which of the following is the most likely diagnosis? Adjustment disorder with anxiety, agoraphobia, generalized anxiety disorder, normal sinus, panic disorder, or social anxiety disorder. So let's talk something about the social anxiety disorder. The diagnostic criteria for the social anxiety disorder is that you need to have marked anxiety about more than one or equal to one social situations for more than equal to 6 months. Like our patient, she had started having the symptoms 6 months ago, so it has been already been 6 months. Fear of scrutiny by others, humiliation and embarrassment. Our patient also has that. Social situations avoided or endured with intense distress. Okay, same as mentioned in our question, marked impairment in the social, academic, and occupational behaviors, and sometimes specific when there is only performance only social anxiety, when only like the patient want to give a speech in front of the school assembly, then only she has some sort of anxiety. Okay, the treatment is generally by SSRI or SNRI. Cognitive behavior therapy is very, very useful, and we also give beta blocker or benzodiazepine for that performance only subtype of the social anxiety disorder. So this patient's intense social anxiety in which he fears embarrassment and scrutiny by others is characterized by of social it's characteristic of social anxiety disorder. Now, it is a common psychiatric disorder with typical onset in adolescence that can result in significant impairment in functioning and quality of life. Social interactions with peers and meeting new people cause significant distress. Anticipatory anxiety weeks before social event and avoidance, like not going to parties, school refusal, are common. The patients with social anxiety disorder frequently appear ill at ease during the interview, avoid eye contact, and give overly brief responses, like I am only a shy person, and may exhibit physical manifestations of anxiety like blushing, sweating, trembling, or tachycardia. The specific performance only is given to patients who have symptoms only in performance situation, like speaking or performing in public. And let's do one more question here. So, which of the following is the most effective long-term treatment for this patient's condition? A 32-year-old man comes to the office due to his disabling anxiety. The patient was recently promoted to his company's headquarters, requiring him to work on the 48th floor of the building. Now, as soon as he steps on the elevator, he feels panicky and faint sweats profusely and has heart palpitation. The patient is worried about that he might have to resign if he's unable to control his anxiety. His fears of elevators dates back to his childhood, and he drinks 1 or 2 beers on weekends, okay, but does not use tobacco or illicit drugs, so substance abuse is ruled out. And which of the following is the most effective long-term treatment for this patient's condition? Alprazolam, cognitive behavior therapy, escitalopram, propranolol, psychodynamic therapy, or supportive psychotherapy. So we are talking here about the specific phobias. So whenever there is a marked anxiety about a specific object or situation, like the phobic stimulus for more than 6 months, okay, and the common types may be a fear of flying, fear of heights, fear of animals, injections of blood. Avoidance behavior like avoiding bridges and elevators, refusing work requiring travel, and it is common in 10% of the population and usually develops in childhood and is often after any traumatic event. Like if the child had been stuck in elevator, then after that event, he may refuse to get into elevator. And the same thing may be happening with this patient in our question. So the treatment is by cognitive behavioral therapy with exposure, that is the first line, and short-acting benzodiazepines have a limited role but may help only acutely your therapist is unavailable or there is insufficient time. So this patient marked an immediate fear in a specific situation that is elevated as phobic stimulus is consistent with a specific phobia. Now, although he feels panicky when confronted with the phobic stimulus, he does not have unexpected panic attacks as in panic disorder. Cognitive behavior therapy involving systematic repeated exposure to the phobic stimulus is the treatment of choice for a specific phobia. Exposure is typically performed in a gradual stepwise manner, resulting in decreased anxiety over time as habituation and extension occur. Confrontation with the phobic stimulus in a safe and controlled manner can be accomplished through in vivo, most effective imaginal and virtual reality exposure techniques. Let's do one more question here. What is the most likely diagnosis for this patient? A 42-year-old woman presents to her primary care physician with a history of avoiding public spaces and open areas for the past 6 months. Now, she describes experiencing intense anxiety and panic attacks when confronted with the idea of leaving her home or being in crowded places. Now, to avoid these situations, she has significantly limited her activities, impacting her ability to work and engage in social interactions. And the patient denies any specific fears related to the environments, and she avoids and reports that she feels safer and more in control when staying within the confines of her home. Now, what is the most likely diagnosis for this patient? Social anxiety disorder, panic disorder, agoraphobia, specific phobia, or obsessive compulsive disorder. Now, the patient's avoidance of public spaces, open areas, and crowded places due to intense anxiety and panic attacks, along with a preference for staying within the safety of her home, is indicative of agoraphobia. Agoraphobia involves the fear and avoidance of situations where escape might be difficult or help might not be readily available in the event of a panic attack or other incapacitating symptoms. So the option C, agoraphobia, is the correct answer. Social anxiety disorder, as we have discussed, involves the fear of social situations and the potential for embarrassment or humiliation. The patient's avoidance is not primarily related to the social interactions. Panic disorder is while panic attacks are mentioned, the key feature in this case is the avoidance of a specific situation. A specific phobia is characterized by the fear and avoidance of situations rather than specific objects or stimuli. Now, OCD involves the intrusive thoughts and repetitive behaviors, and the patient's primary symptom in the avoidance of specific situations due to anxiety. So what we have learned today is that there is something called as social anxiety, there is specific phobia, and there's agoraphobia. Okay, now social anxiety may have a specific type called as performance only type of social anxiety, which can be treated by beta blocker or benzodiazepine, okay, just before the person has to go for the performance. And then there is the some of the specific phobias, okay, which is where we just go for the cognitive behavioral therapy with exposure sort of therapy, okay, which we uh, by a small amount, we just expose the patient to the phobias and we make them sensitized to the phobias that they are scared of. An agoraphobia is when the patient does not want to interact and just want to just want to be secluded inside his or her home. But the main concern with agoraphobia is that if the patient may have panic attack, which may cause very debilitating symptoms, then the help cannot be sought out at that panic attack. So that is one very complicating part about the agoraphobia. Thank you for watching. Keep studying hard.